Thank you, Mr. Chairman. I appreciate the warm welcome to the committee, and look forward to working with everybody. I've been blessed for the last 30 years to be a practicing physician. In fact, I still am. I still see patients, still operate. And so I have seen firsthand so many of the issues that we faced with mental health in our emergency departments, in our hospitals, in our clinics, and it's tragic. The system that we face is tragic right now. I recall now, someone was talking about pediatric patients in the emergency department. I recall a couple years ago we had a child in our emergency department, I believe was 14 years old, that sat there for 56 days, taking up a bed, that we did not have access to resources for that child. That's tragic, that should not be happening, and it definitely needs to be addressed. I also want to talk about not enough doctors, not enough clinicians, psychologists. Without a doubt, we are in a massive shortage. I'm in the most critically short surgical specialty in urology. We're going to lose half of our individuals now are 58 and older, a third are 65 and older. We're going to hit a precipice very soon. That isn't filled by adding mid-level providers, nurse practitioners, PAs, which do a fantastic job, but they are not physicians, they are not surgeons. That's not how we fill this. And I applaud my colleague, I apologize, I can't remember who that was, that wanted to increase GME money. It's long since overdue. One thing I would tell you is one of the problems that we're having in the physician workforce is that people graduate from medical school and then they don't become practicing physicians. They choose other lines of work, or they stay at home or do other things. And so I think adding that money to GME is great, but let's put skin in the game and make sure the people that were graduating from medical school actually stay and practice medicine. That would truly help our problem. I've seen so many of the issues, obviously, of the past year that everybody has talked about ad nauseum, about lockdowns, about masks, about forced vaccinations. You know, at first we didn't know what we were doing about this, and all those things were 100% the right thing to do. Sadly enough, over a year ago or so, politics finally took over. Where we're shaming people that are not wearing masks, and we're shaming people who are not vaccinated. We're closing businesses, throwing people into unemployment and depression because they're not following certain rules, because the rules sure as hell don't follow science. And that's caused a massive tragedy to us today. And sadly enough, while we were building a ship, while flying it, we could have corrected things easily over this past year. Unfortunately, this administration has not, and it's further divided our nation. So we're faced now with a major problem in our mental health issue, one that has spiked in overdose uses. I worked a lot when I was in the State House on our opioid epidemic, and we made great strides. But sadly enough, with our porous southern border and increased demand because of depression, now we've seen 100,000 people die from overdoses. It's a tragedy. That should not be happening in this country. So I could go on and on just about personal experiences, but we have wonderful witnesses today whom I'd like to thank for coming and sharing their testimony. I do just have a couple questions because, you know, things that we do in this government actually have results. They have consequences that, that now we're having to deal with. So actually, Dr. Powell, if I could address a question. And I'm going to ask you, you know, in 1965, the Great Society programs came out. And I just wondered what your thoughts were what do you feel that the breakdown of the nuclear family has done on the crisis of mental health issues for children?
So I think it's really important for us to acknowledge that, as you have lifted up so importantly, that families play a critical role in ensuring that youth develop positively. But I think we've also, in our, inclination to think about family structures in our past and present, we have unduly, I think, pathologized families that are poor, that are operating with matriarchs at the head. And we have not considered all of the other social factors surrounding those families that give rise to poor mental health. So I think family systems and strengthening the family, we have to absolutely continue to do as a nation if we're going to get our arms wrapped around this problem. But families don't exist in a vacuum. Our families actually exist.
I'm sorry, Dr. Powell, I kind of spoke too soon or too much, so I don't have much time, but I thank you. I appreciate that. I always, when I see young children and a single mother, I plead with that mother to read to that child. I plead with them to try to find a father figure in that life because it means so much, not only to young men, but to young women. Quickly, I'm sorry, Ms. Avila, quickly, just in North Carolina, how can we help address the opioid epidemic and the number of individuals that are now dying?
Yeah, thank you for the question. North Carolina has actually done, as I'm sure you were aware, an amazing job with its opioid action plan. One of the things that North Carolina was able to do was to keep its OTPs open, and we saw an increase in individuals getting care and services in opioid treatment programs. I think one of the things we will continue to do is look at expanding those programs, looking at expanding medication-assisted treatment in jails and communities, and also looking at prevention strategies. We're also doing a number of things in communities to prevent opioid use disorder, and we will need to continue to do that. And we've got resources from the federal government. Any additional resources would obviously be put to very good
All right,
use.
thank you, thank you. I went over my time. I appreciate your
gentlemen.
counsel today.